Anyone who's been in hospital with the virus and survived will probably never forget how scary it was. Some make a full recovery, of course, but new research by Leicester University shared with us shows 7 out of 10 still have symptoms 5 months after they've returned home. And the people most likely to be left with long-term effects are white, middle-aged women with underlying health conditions.
And blow hard, and blow, 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 blow. Keep going, keep going, keep going. Push, 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 push.
Okay, a bit quicker again.
Can I ask how you feel?
Short breath and wobbly legs.
Researchers at Leicester University have been trying to find out why these women are still so ill after having COVID. You could say their results are groundbreaking.
Is this normal?
Yeah, it's quite a regular thing for a lot of the patients to feel like this afterwards.
Nikki, who came to hospital with the virus, finds the walk test at this long COVID clinic exhausting. The study found 70% of hospitalised patients haven't fully recovered after 5 months. It's been even longer for Nikki, who still suffers extreme tiredness and memory loss.
I was active. I was running around Mum's taxi service, looking after the house, doing meals, walking the dog, just general things. And that's something that I haven't done for a year.
Okay, Sandra, so we're going to do a test that measures the strength of your hand grip. Which is
After assessing 1,000 patients, scientists found long COVID affects more white, middle-aged women with underlying health conditions. They point out that's in direct contrast to the older men who have worse outcomes from COVID in hospital.
It may well be that it's due to differences in the immune response and then the inflammation that then occurs from the immune response. So what I mean by that is it might be that the response is worse in the acute setting in men, whereas it leads to a more chronic inflammatory response in women, leading to a higher likelihood of having long-term problems.
That's 1, 2.
I'm still getting pains in my back, swollen legs and feet, ankles.
Symptoms like Sandra's are vague and wide-ranging, making it hard to diagnose. Each patient has an average of 9 symptoms. The most common are muscle pain, fatigue and brain fog.
I do feel that I'm probably back to about 80% of my normal activities and fitness. I just want to get back to 100%. I'll do whatever they need to do to try and help to get over this horrible illness. Because it's a horrible illness, and I don't think some people just don't realise how poorly you can be with it.
There are now tens of thousands of people who might be daunted by their staircase at home. Nikki knows this is only the first step to understanding the illness, but it's a big step nonetheless. Emily Morgan, News at 10 in Leicester.